Light for the World is an international organization which focuses on empowering people with disabilities and also preventing disability from happening. In addition to all that, we have comprehensive eye health programs in Uganda, Ethiopia, Mozambique, and Burkina Faso. In Uganda, we are supporting a program called 123 I Can See. It's a child eye health program where we aim at reaching children at an early age who may have visual impairment and ensuring that they access all the support that they need in terms of treatment, but also in terms of their education.
Glaucoma is a disease that affects the nerve of the eye, and about 5 in 100 people suffer from this condition. And the nature of this disease is that the earlier you find it, the better you're able to halt it in its early stages, because there's no treatment that can reverse the damage to this nerve. The nature of the disease is that it first damages your ability to see things on the sides, but you may not notice it. You just still be able to see everything clearly at the front of you. So you normally have life. Maybe if you're driving, you may start noticing that you're not seeing very well, like when borders are driving and coming from the sides, maybe you may not. But you see, this is such a small thing, and even it happens later on in the disease that you may not notice until a time when now you're seeing at the front, which you will quickly notice reduces. That is in the last stages of the disease.
Light for the World has glaucoma very close to our hearts. We piloted and developed a manual called the Glaucoma Toolkit for Sub-Saharan Africa. This is a manual that simplifies the management of glaucoma. Working in partnership with the Ministry of Health, we endeavor to reach out to districts that are outlying, that are far from the central. For example, this child eye health program, our main districts of operation include Kapchorwa, Iganga, Adjumani, Moyo, Hoima, Chikuwe, Tungamo. Most of these are really far away from the center. That is our main approach, trying to reach those who are difficult to reach. During this glaucoma week, I would appeal to especially people who are age 40 and above to make sure they purpose to have an eye checkup at least once every year. And then even those who are below 40 and they are visiting eye health personnel for one reason or the other, it's not bad to request for pressure check just in case there is glaucoma.